today we are going to talk about the alopecia. Alopecia is the name given to the condition related to the relatively abundant and premature fall of weakening hair. The process in the vast majority of cases begins at the apex of the skull, crown, and on both sides of the forehead. The symptom of the alopecia is loss or weakening of hair. Alopecia is diagnosed through a medical history and physical examination. Your doctor will ask you questions about your hair loss, observe the pattern of hair loss, and examine your scalp, and he or she can gently pull some hair strands or pull off a few. If the reason for your hair loss is unclear, your doctor may do tests to check for a disease that could cause your hair loss. The tests include hair analysis. Your doctor will take a sample of your hair and examine it under a microscope. A sample of the scalp is also sometimes taken. Blood tests include tests for a specific condition such as an overactive or hypoactive thyroid, hyperthyroidism or hypothyroidism. Regardless of where genetics influence, it is not necessary. Adequate food is necessary, combined with a healthy lifestyle that does not include aggressive cosmetic procedures. Drastic diet that can cause a broad hair drops should be excluded. Diets that are poor in trace elements or vitamins should be avoided as they cause dryness, roughness, or progressive loss of glossiness. It is advisable to go, especially in case of fall or loss of density, to make diagnosis. The optimal resolution of hair loss requires preventive measures that anyone can adopt since today the vast majority of hair problems have an effective treatment, especially if they are diagnosed in. Here are 5 procedures to improve the appearance and amount of hair, from the simplest to the hair implant, and 5 substances that embellish the hair. Cosmetic. The use of lotion and shampoos with different active ingredients is in full swing. Ideally, they should be prescribed by the doctor. These are TRX2. Its natural ingredient helps reduce hair loss and stimulate healthy hair growth from the inside. Foligain P5. It is a product especially developed for men with alopecia. The 5% minoxidil solution can help promote stimulation of the scalp and hair follicles. Mesotherapy. They are small injections that are applied to the scalp. The active substance against the hair follicles and the environment. It is applied once a week. The most commonly used substances are minoxidil, finasteride, butyrate, and several amino acids. It is common to have a minimum of 8 sessions of mesotherapy. The first 4 once a week, then 2 every 2 weeks, and the last 2 within 30 days. Minoxidil topical. It is applied as a lotion. This active substance has a direct stimulating effect on the hair follicles. It is applied twice a day. The benefit of it
use are evident after 4 or 6 months and have a maximum effectiveness of 1 year. It should be noted that it's contraindicated in people with hair problem of hypotension. Oral finasteride. Finasteride inhibits the transformation of testosterone, which is the male hormone. It blocks the harmful action of androgen on the hair follicles. Results are shown after 6 months. One important caveat: in all cases, it must be a doctor who prescribes and controls consumption. Hair microtransplant. This option offers a definite solution and the results are excellent in the hands of a good plastic surgeon and during the current distribution. It is completely natural. The intervention consists of the extraction of the hair to obtain the graft. The placement or implantation is performed through small holes.
The substance here: collagen, amplitude high fiber under hairs, elastin, is protein that has structural effect. It is polymer with enormous capacity of expansion to provide elasticity. Silicon is placed to protect the shell. It forms a protect a film. Ginseng, reduce dryness, contains polysaccharide, vitamin D and B, proteins, amino acid, and dry elements. Factor of sun protection. Many hairs produce contain protection factor included in oils, milks, or syrup. They are very effective in preventing dryness. Alopecia does not present health risks. It only causes hair loss. In many cases, the appearance of infection or scar provide a connection to alopecia, but does not affect the health of the person. It is common for total hair recovery to occur in people with the condition. However, some people may have an encouraging prognosis because they have the following. First, alopecia at an ear age. Second, eczema, atopic dermatitis. Third, prolonged alopecia. Fourth, severe loss of hair.